Our next section is amniocentesis. Amniocentesis is transabdominal needle withdrawal of amniotic fluid under ultrasound guidance. This is also a diagnostic outpatient office procedure performed after 15 weeks under ultrasound guidance with or without local anesthesia. Now, I've done thousands of these, and I used to do local anesthetic. One time a patient came in and said, I'm allergic to the local anesthetic. So I did it without, and it was less painful without than to put the anesthetic in and cause the burning. And so nowadays, most practitioners do it without local anesthesia. You aspirate the fluid, and within the amniotic fluid are floating amniocytes, which are living fetal skin cells, which are floating. And as you take those out, you can then culture them and obtain the chromosomes. An advantage of the amniocentesis over the chorionic villus sampling is that you can take from the amniotic fluid and test for amniotic fluid alpha-fetoprotein. Maternal serum AFP has a significant false positive rate. The amniotic fluid AFP is a very low false positive rate. In other words, the maternal serum AFP can be elevated and there's no neural tube defects. But if the amniotic fluid AFP is elevated, there's almost always an open neural tube defect. And that is one of the benefits of the amniocentesis. When you do a CVS, you have no way of assessing for neural tube defects. Whereas the amniocentesis, you not only get the karyotype, but you can also get an amniotic fluid AFP. Pregnancy loss rate is a little bit lower than with chorionic villus sampling, but again, a lot of this is operator and experience dependent. The amniocentesis is probably the most common invasive diagnostic test which is done prenatally. The most common diagnostic test is ultrasound. Here we see under ultrasound guidance, this is the ultrasound probe, a needle is placed into the amniotic sac, and floating in the amniotic fluid are these amniocytes. It's interesting, if you have a fetus that is dead, and if it's a recent death, you can still do the amniocentesis and find living cells which you can culture and obtain the fetal karyotype. Here is a photograph of an amniocentesis being performed, and this is a syringe which is aspirating the amniotic fluid. And that is the end of the section on amniocentesis.